Your body is roughly 60% water. Every organ depends on it. Your kidneys need it to filter waste. Your brain needs it to function. Your blood needs it to carry oxygen. Take water away slowly enough and the decline, it looks kind of like normal aging. But you take it away long enough and it becomes a medical emergency. Of all the ways a nursing home can fail a resident, dehydration might be the hardest one to justify. I mean, water's free. It's right there. It's not hard to get. And a resident who cannot get to it themselves is depending entirely on the staff to bring it to them. And in many cases, to even help them drink it. And when that doesn't happen, when something as basic as not getting enough water happens, that is when a resident ends up in the emergency room with severe dehydration. And dehydration can often lead to kidney failure, sepsis, and even death. I'm David Terry. I'm a nursing home abuse and neglect attorney in St. Louis, and I've been handling legal cases against the nursing home industry for 25 years. And dehydration is often one of the main factors in many of my cases. Dehydration causes a lot of things. It causes confusion, falls, urinary tract infections, and when it goes far enough, it can cause death. Federal rules require the nursing home facility to assess that risk, offer sufficient fluids, and respond appropriately. A nursing home cannot just wait around for a resident to ask for water and then deliver it. That's just not how this works. Every facility that accepts Medicare and Medicaid is required to proactively ensure adequate hydration for every resident. Now that means a care plan built around each person's actual fluid needs, including residents with swallowing difficulties, residents on diuretics, or residents with diabetes, and residents with dementia who cannot often connect the sensation of thirst to the behavior of asking for water. The facility must identify who is at risk and ensure that they are getting adequate fluids and then act on it when they aren't. This is not just a courtesy that they do for residents. It is a baseline requirement. And when a facility is short-staffed, hydration rounds, they're one of the first things that get skipped. Now, usually that's not done maliciously, but it's a predictable consequence of prioritizing owner profit over adequate staffing. So what does dehydration look like in a resident? Let's say that you visit your dad. The nursing home is documenting normal fluid intake, but he looks worse every time you visit. His lips are cracked. He has a dry or sticky mouth. His eyes have become sunken with dark circles underneath. He has a decreased urine output, or the urine that he does output is dark in color. He has low energy with periodic bouts of dizziness. And the one thing families often miss the most are new episodes of confusion or agitation that kind of comes out of nowhere. Dehydration causes or can cause confusion in elderly adults even when no dementia is present. For a resident who does have dementia, dehydration-related confusion looks like rapid cognitive decline. And nursing homes, they're going to sometimes document that as just their dementia getting worse, completely overlooking the dehydration that the resident is experiencing. Now, when you ask about this, nurses will often say that, well, their dementia is progressing. But what was actually progressing was the dehydration that nobody was paying attention to, nobody was treating. Now look, if your loved one seems suddenly much more confused than their baseline, don't just accept what the nursing home tells you at face value. Trust your gut. The good news is that dehydration is easy to determine. A simple lab test tells you everything you need to know. Now, some families think dehydration is a minor issue. I'm telling you, it is not. It is often the first link in a chain that can end in a hospital bed or even worse. Concentrated urine from inadequate fluid intake creates ideal conditions for bacterial growth. That's how dehydration leads to urinary tract infections. And UTIs are among the most common infections in nursing homes. Why is that? Often because of dehydration. And look, a UTI that is not treated promptly in a resident who's already weakened by dehydration can progress into sepsis. Now, I covered that in detail in another video on this channel, so go take a look at that video. But dehydration also can cause a sudden drop in blood pressure when a person stands up, and that is a major fall risk. And sustained dehydration is a direct cause of acute kidney injury, which can be accelerated oftentimes by the medications that many of the residents are already taking. And if your loved one has suffered a urinary tract infection, a fall, a kidney problem, and a dehydration diagnosis, don't look at those four as separate events. In many cases, a nursing home that failed to ensure adequate hydration can be the cause of this entire chain of potentially deadly events. So don't ever just discount dehydration as a one-off. It is a critical issue. Now look, I do want to be fair. Not every case of dehydration in a nursing home is neglect. Elderly adults often have diminished thirst response, and some conditions genuinely make fluid balance difficult. A facility that is monitoring closely, adjusting the care plan, involving the physician, and communicating with the family is doing its job in a tough situation. So here's the test. If the facility can show you fluid intake tracking, physician involvement, care plan adjustments, and family communication, that's a real response. Now, if the facility can show you intake numbers on paper, but there's no physician involvement, no care plan adjustments, and the family's just left in the dark, then when the resident ends up in the ER with severe dehydration, that is where your case begins. Now, if you're concerned right now, start documenting. Request records in writing and keep a copy of those records. Ask the director of nursing what the facility is doing about your loved one's fluid intake, and ask them to document your conversation in the chart. If the answers are vague or defensive, ask for a care plan conference and demand to see all the records associated with your loved one's hydration. Now, if you believe your loved one was seriously injured or died from dehydration, file a complaint with the state agency that oversees nursing homes. In Missouri, that's the Department of Health and Senior Services. In Illinois, it's the Department of Public Health. And if there's been a serious injury or death associated with this, you can feel free to call our office. I've handled numerous cases where dehydration was a major factor. The consultation's free. There's no attorney fee unless we recover for you. One of the biggest mistakes you can make is trusting what the nursing home tells you when your eyes are telling you something different. I always tell people, trust, but verify. Always verify. Go into this with your eyes open. The number one priority for many nursing homes is themselves, not your loved one. You got to remember that. They are mainly concerned about themselves, not your loved one. Dehydration can lead directly to urinary tract infections, sepsis, falls, kidney damage, and I've covered exactly how that chain works in our sepsis video. So go watch that next video so you can understand the full picture of how important it is to be completely hydrated. I'm David Terry, and I'll see you over there.